And New York City Mayor Bill de Blasio, he's endorsed Senator Bernie Sanders for president. Great to have you on the show, Mr. Mayor.
Great to have you here, Mayor de Blasio. We're going to talk politics in a minute, but first let's talk about the coronavirus.
Yep.
Obviously, there's a Westchester County case, which shows just how quickly the coronavirus spreads. A 50-year-old lawyer gives it to his family, and the man who drives him to the hospital, who also spreads it. This is obviously not a virus that you want to treat the way the President of the United States says, which is, oh, just sit around and go back to work. What is New York City doing to limit the spread of this virus?
Yeah, Joe, right now we're in a containment strategy, and so far it's working. It's going to be a big question going forward, how much we can sustain that here or anywhere else in the country. But the bottom line is test the most people possible who are pertinent, stay ahead of the situation, get people immediately isolated who need to be isolated, get them care. You know, if there's good news here in our experience, we only have 4 people as of this morning who have tested positive. Of the tests we've completed, 25 have come back negative so far. So the batting average is good. On the 4 people, the ones who were previously tested, the 2 of them are doing better. So in terms of folks coming through this okay, we're seeing, obviously, if people get tested, get care immediately, get isolated, the vast majority of people are going to come through okay. The problem is the federal government was very late to the dance in getting tests out to localities. They're still late in terms of getting the volume we need. Right now, we can test dozens of people on a single day. We need to get that up to hundreds, maybe even thousands very quickly. We can't do that alone. We need the federal government. There's a strange kind of approach avoidance, to use the psychological term here, in the federal response. It was deny and underestimate for a while. Then it seemed to pick up in the last few days, but it's still not materially what it needs to be. Localities need the maximum ability to test. That will help us to have a chance to stay ahead of this and make sense of it. It's also reassuring to people, Joe, when folks hear actual, consistent, transparent information. And I say we're trying to be the anti-China in New York City. We're trying to constantly update people right down to the specifics of the person, where they're from,
right,
what school they went to, whatever it is. That helps people stay calm. We can only do that if we have testing and the ability to constantly update the reality.
Mr. Mayor, at the risk of turning this into a New York One interview, let's talk about what's happening. I love New York One, by the way. Let's talk about what you would say to families this morning. A lot of parents getting up with their kids today. I hear it in my own house. I hear it from other families that we know. They're worried about putting their kids on the subway. That fear creeps in when they don't have as much information as perhaps they need. So what are you saying? And I think I joke about New York One, but this applies to cities across the country. What are you saying to people in terms of how they should proceed?
Look, I was a public school parent, so I would say exactly what I said for my own kids. And it's really important to understand what this disease is and what it isn't. Our public health folks constantly make the comparison to measles. If we're hanging out here, you know, we can transmit measles very, very easily. Coronavirus so far takes more to transmit. You need to really have some direct contact. You need to have the kind of exposure that you wouldn't get casually on the subway, for example. The other thing is, historically, what we're seeing over these weeks is young people do a lot better than older people. Healthy people do a lot better than folks with pre-existing conditions, particularly respiratory conditions. So here's my message to parents. It's simple. If your child's healthy, you basically have very little to worry about. If your child has a serious respiratory problem, we want to really keep an eye on the situation. If anyone in your school or in your life may have it, we want to make sure there's separation immediately and that we protect your child. But that's the exception, not the rule.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.